morning, everybody, and a very warm welcome to all of you joining this morning's high-level roundtable on innovative finance to accelerate investment in primary healthcare and health systems resilience. My name is Shireen Wheeler. I work for the EIB, so I have to give you that inside knowledge, but today I am your neutral moderator. I have no allegiances whatsoever except to the mission that we all share in this room today, which is to support investment in health, in primary healthcare and the resilience of healthcare systems. Now, we know that the pandemic took a terrible toll on people's lives, on their work, but as much as that, it exposed huge health inequalities that we all know exist. And it is that and the financing approach, the cooperative financing approach, which is very much at the heart of this summit, that we're here to talk about. We're here also to celebrate the launch of a new platform, which also very much encapsulates the call for cooperation among multilateral development banks, regional partners, and of course, international organizations like the World Health Organization, which has been the absolute catalyst for what we're talking about today. I'm not going to talk too long, but just to say that we're delighted to have all of you here. We have a fantastic group of people representing all these partners with whom we're going to share perspectives on the nature of the challenge, the kinds of solutions we want to see coming forward, and the way in which we can build further on the partnership, the platform that we are announcing today. But I want to first of all introduce the Minister of Health from France. François Braun, we're delighted to have you. We're very grateful for this summit as a whole, which of course has as one of its core elements, we talk a lot about the climate challenge, but the health challenge is intrinsically linked to that as well. So I wonder, Mr. Braun, as the host of the event, if I can ask you a little bit just to help us frame today's discussion and tell us a bit about how you see this challenge in the context of the call for a new global pact for financial architecture and the role of international organizations and entities. I'm going to ask everybody to be very brief today, but over to you.
Thank you. Dear Prime Minister, dear Dr. Tedros, distinguished managing directors, and dear colleagues. I'm delighted to take part in this event in connection with the Paris summit, which by President Macron. As we all know, the COVID-19 pandemic showed significant gaps in health systems around the world. It is particularly true in the primary health care. As a result, millions of people lost their lives and the health of billions more was compromised. We witnessed incalculable social and economic disarray. It made clear that non-communicable disease, the world's leading cause of death, amplifies our vulnerability to emerging disease. Compounded by the worldwide shortage of healthcare workers and unequal access to health products, we have seen a decline in health conditions. Facing such challenges, what can we do? As a minister and an emergency physician, I am deeply convinced that we cannot afford to wait for the return to sustained economic growth to meet pressing health challenges. We must act now for the health of tomorrow and get back on track towards the Sustainable Development Goals. Strengthening collaboration between multilateral development banks and Organisation International is very critical in this regard. Our world urgently needs a more coordinated financing approach to bridge the gap between health system investment needs and the challenge of limited domestic funding. Establishing effective financing arrangements is critical for the development of high-impact, equitable, people-centered primary healthcare services. In this respect, and I'm delighted that the World Health Organization and a core group of multilateral development banks commit to provide coordinated approach to investments in primary healthcare in support of low and middle-income countries. We all especially need to catalyze financing for investment in health system, for universal health coverage, and together with the Pandemic Fund and all the global health initiatives such as UNITED, the Global Fund, and GIG. This is why France is supporting the joint work of all public development banks, especially in the framework of the Finance in Common coalition of more than 550 development banks. Catalyzing financing for primary health care will act to tackle inequalities and promote investment in climate resilient, low carbon health system. I am confident that the HIIP being launched today will bring added value to those efforts. Dear Dr. Tedros, I would like to thank the World Health Organization and you as Director General, as well as the European Investment Bank and its President, Werner Hoyer, for this side event, which provides an opportunity to remind us just how essential health financing is to the well-being of our population. Last but not least, I would like to thank all our financial partners for their commitment to health, to strengthening healthcare system and to reducing social inequalities in health throughout the world. I stress once again, it is only by giving ourselves the means to achieve our ambitions that we will leave no one behind. This is our shared ambition in the Paris Summit. Thank you for your attention, and now I will listen carefully to you.
Thank you so much, Minister. And of course, nothing will happen without our regional partners. And that's why we're so delighted today to be welcoming you, Prime Minister, from Rwanda, and also on behalf of Mia Mottley, who of course has been championing the Bridgetown Initiative, which is framing much of this discussion in these last 2 days, Foreign Minister from Barbados. Let me ask you, Prime Minister Ingerente, first of all. We've talked about partnership a lot, and the Minister's talking about the need to act now. And actually, Rwanda is already acting. There's an excellent pilot project between the WHO, EIB, and Rwanda and the EU on the primary healthcare national laboratory system. It's a flagship project, I believe, of the President, Paul Kagame, as well. Tell us what you can share with us, some insights and benefits from this partnership.
Thank you so much, and good morning, everybody here. I think, as I said yesterday in the last session, there are things you can't do alone as a country, and that include, of course, the climate change issues, but also health systems. You can't build health systems with alone as a country. So we need real partnerships. And what we have seen in Rwanda is that with that partnership we have been building since more than 10 years ago, we are gaining results now in terms of healthcare system. What we have done, we have seen even a result in terms of life expectancy, which has been improved over 20 years, but also some other key indicators in terms of health systems. What we have done is, when you want to build health systems, you need to focus on different things, including the key ones, which are having health facilities. And you can't do that as African country because you need resources. You need to partner with different experts, but also different MDBs and other financiers. So you have to have health facilities first, because the population is growing. You have to increase the number of health facilities. This is what you have done with our partnership. The second thing is to make sure that those health facilities have equipment. With this partnership, we have equipped the hospitals, health centers, and health posts. So the third thing we may forget sometimes is human resources. You can have health facilities, equipment, but if you don't have human resource, you lose everything. So our partnerships also have been focusing on human resource, building capacity of medical doctors, nurses, and other technicians. So this is why within that partnership we have called Human Resource for Health. That's the program. We have a program for 10 years in Rwanda, within which we plan the way we'll be training our health professionals. We have every year we have a number of nurses to be trained, a number of doctors to be trained, a number of other medical technicians to be trained. So we have a target for every year and make sure that we achieve that within that partnership. So the additional thing, as you said, is integrate the laboratory system, which we have been working on with the other partners, including the European Investment Bank. We're doing very well, and we don't have enough time, as you said. I'm told I'm given only 3 minutes, but in the summary is that. So we believe in partnership. You can't build your health system alone. You have to be with others, including financials, but also other academia to train your people, because there's health system with human resource, with no skilled human resource. Thank you so much.
Thank you so much, Prime Minister. I mean, I think we are all profoundly inspired by the work your country is doing, and we're very happy that you're here today to share that. I want to ask the Foreign Minister, Kerry Simons from Barbados. I know that you're looking, I was told earlier, very closely at what Rwanda is doing as well, actually. So I wonder whether you can give us a sense of how inspiring you find that, and also, given the kind of framing of this summit, to what extent where do you see the biggest gap? Where do you see the biggest challenge?
Thank you for having me, and very good question. Let me start first of all with the Rwanda aspect of it. We have, with the tremendous support of the European Union and the European Investment Bank, started to build a partnership with Rwanda and also with Guyana, who is our neighbor to the south, with a view to starting to do pharmaceutical production in the Caribbean. We do this simply because of the experience of the COVID pandemic. Economically, it was a set of circumstances where, as you would imagine, tourism economies in the Eastern Caribbean, borders are closed. Imagine, if you will, the consequence of that. The main artery of economic activity comes to an end for virtually a 2-year period, and then you're faced with a set of circumstances where you have double-digit decline in GDP. In fact, the 20 most severely affected and impacted countries in the world as a result of COVID, in terms of their GDP decline, are to be found in the Eastern Caribbean. So the thinking then became, how do we save ourselves from ever having to go through this type of thing again? Part of the thinking on the question of the vaccines was obviously the vaccine inequity, because countries of the north who were industrially able to produce, perhaps understandably so, but prioritized their requirements at home, and in some cases hoarded, so that we were placed on waiting lists. And were it not for being part of our ability to be part of the African Union procurement system, we probably would have suffered a much more heavy blow in terms of our reality. So that ties into the Bridgetown concept, the Bridgetown initiative concept, because we are talking about a broken financial system in terms of the architecture. We're talking about systemic inequalities, and we're also talking about the absence of a fairly just industrial strategy. We go into this effort, therefore, with the support of the European Union to try to stimulate opportunities now for there to be pharmaceutical production, not only with a view to vaccines, but for other illnesses, some of which, quite frankly, can be identified as being peculiar to the, I don't just want to say race, but peculiar to people who live in some parts of the South. And they may be cancer related and so on and so forth. The other aspect of this, though, is the financial solutions that we're trying to identify. And it is at that point, I think, that there is a massive intersection between the discussion on climate, the discussion on health, and the discussion really on development. What we are trying to promote with regard to climate, and I think it was announced last night by Ajay Banda, is you have the new approach to loans which will carry climate-related clauses.
Yes.
So that you suspend the debt obligation for a period of time then once a certain threshold is met. In Barbados, we are already blessed with pandemic clauses in our sovereign bonds, where we are saying equally that once a certain threshold has been met, It might be a WHO declaration of a pandemic. It might be a national public health emergency which has been declared. It may just be that we've had to spend $30 million in emergency circumstances on public health issues. But at that point, and this works obviously not universally, but for small states, at that point it triggers the type of intervention that will allow states to have that flexibility in that rule. And that is the way in which we see it. The only last point I'll make to you quickly is the question of resilience lending. We feel strongly that longer tenor, for example 50 years, makes more sense for public health care investment. If you have to build emergency hospitals, I mean, COVID taught us that there were no critical care beds of any significance in Barbados, maybe 50 or so to serve a whole island. Critical care beds became a critically important thing immediately. We had to build a whole hospital, $15 million. So in those circumstances, if you have a longer tenor, then the interest rates can fall, makes it a lot more accessible for small states.
Thank you so much, Foreign Minister. And I see that the heads of the MDBs here are listening intently, and I know that many of the things you're talking about and so successfully have brought to the table are very much being looked at in detail. You mentioned the African Union and the importance of the African Union during the pandemic for Barbados. You also mentioned the European Union and the work that is going on with the EU to build up that local manufacturing base for Barbados in medicines, but also other countries. So I'm delighted that we actually have both the President of the African Union Commission, also the Commissioner from the European Union responsible for international partnerships, and that political support, but also the actual organisation, convening power, legislation is absolutely key to making partnerships like this work. I want to turn to you, first of all, Mr. Moussa Faki Mahamat. Tell us a little bit about how you think the international community, in particular the MDBs, can deliver impactful investment in primary healthcare and build health systems for the continent, which of course we know this continent, Africa, is a key priority for this platform that we're announcing today.
Merci Madame. Permettez que je parle en français.
Ok, très bien.
Je voudrais d'abord remercier l'OMS et la Banque européenne d'investissement et tous les autres partenaires d'avoir organisé cette session ce matin sur les investissements dans les soins de santé primaire. Depuis hier, nous parlons des financements du développement. On ne peut pas financer le développement si l'on ne finance pas la santé. C'est une évidence et la pandémie de la COVID-19 nous l'a démontré. Le continent africain s'est doté de tout ce qui est comme instrument. Nous avons lancé et même opérationnalisé Africa CDC.
Yes, you do have interpretation if you need it on the headphone, and it's number. Not sure. I'll tell you in a second. Okay. If we can let the President carry on, we'll try and sort it out. Keep going. Allez-y.
Je disais que je remercie l'OMS et les partenaires d'avoir organisé cette table ronde sur une question essentielle qui est celle du financement de la santé, notamment des soins de santé primaire. On ne peut pas parler de développement sans le financement de la santé. Et la pandémie de la COVID-19 nous l'a démontré. Particulièrement dans un continent qui fait 1,4 milliard d'habitants, avec un système de santé extrêmement embryonnaire et fragile. Et malgré la mise en place des instruments techniques, de législation, notamment Africa CDC, nous venons de lancer AMA, l'Agence des médicaments africaine, que nous sommes en train d'opérationnaliser. Il se pose un problème aujourd'hui de la prise en charge des soins, y compris des soins de santé primaire. Et nos partenaires, notamment l'OMS, l'Union européenne et d'autres avec lesquels nous travaillons, nous devons vraiment de faire en sorte que la prise en charge du secteur de la santé soit effective. Il faut nécessairement former, comme l'a dit le Premier ministre de Rwanda, le personnel de santé. Ça, c'est une priorité. Moins de 1% des vaccins sont fabriqués dans le continent africain. C'est une aberration. On ne peut pas importer pour 1,4 milliard d'habitants de moindre vaccins. Ça, c'est quelque chose qui est absolument impensable et il faut le régler très rapidement. La prise en charge de personnes, et notamment pendant les pandémies, se pose également de manière criante. Des efforts doivent être faits par les États africains qui ont pris des engagements. Depuis 2001, par exemple, de consacrer 15% de leur budget à la santé. C'est vrai, nombreux n'ont pas atteint cet objectif, mais la volonté politique est au moins annoncée. Il y a plusieurs déclarations, dont la plus récente, il y a un mois. Il a été décidé par les États africains de faire en sorte que la question des soins de santé primaire soit la priorité des priorités. Il y a 5 piliers stratégiques. D'abord, financer, renforcer les institutions de santé publique. Je le disais, le personnel de santé publique. Élargir la fabrication des vaccins et des produits de diagnostic et des thérapeutiques, ainsi que l'augmentation des ressources nationales pour la sécurité sanitaire. Et bien entendu, développer des partenariats qui sont axés sur l'action. Si l'on n'agit pas directement au niveau de communautés elles-mêmes, il serait illusoire de pouvoir ouvrir même des soins de santé primaire. Je parle sous le contrôle de mon frère et ami Dr Tedros. Les soins de santé primaire, on en parle depuis au moins 40 ans. Soins de santé primaire, jusqu'à là, nous ne sommes pas arrivés à atteindre ce pays. Et aujourd'hui, avec ces différentes pandémies, il faut donc agir et le financement du secteur de la santé est une priorité pour le continent.
Thank you so much. I apologize for those who didn't have interpretation. I want to just maybe highlight a couple of points that you made for those who weren't able to follow. I know that you believe that African states should be spending at least 15% of their budgets on health and primary health care, and this is an absolute priority. You very much, putting the cards down to the African states themselves to get themselves organized, but of course the role of the multilateral development banks and WHO will be absolutely critical here, as President Adesina obviously knows very well from the African Development Bank too. But it is not just the job, and this is why we're here, of the regional banks to deal with the region, but together to create platforms like the one that we're celebrating today. Now, in a moment, we'll talk briefly to those leaders of the multilateral development banks who are here to share their perspectives, also coming back to Commissioner Okulainen. But first, I want to turn to Dr. Tedros from the World Health Organization. Thank you, first of all, for all your huge efforts in helping to bring this to fruition today, but also during the pandemic. Honestly, you became a great source of reassurance for all of us watching you every day on the television. But Dr. Tedros, you championed the Addis Ababa conference in 2015. This isn't something you've just thought about today for the conference. This is something that's been going on for a while. 10 years later, from Addis to Paris, what kind of progress have we made? Have we got any reason to feel good?
Thank you very much. I think we have made some progress, but it's not significant enough. And that's why yesterday I was listening to many leaders, and the same frustration was being said. Of course, the Addis Ababa Action Agenda was agreed at the end of 2015, July 2015, when I chaired it, when I had the privilege to chair it. And then there were only 2016, 2017, 3 years, of course. Then 2019, the pandemic started. Of course, the pandemic also had some contribution to the fulfillment of the pledges that were made during the Addis Ababa Action Agenda. So there were basically 3 years before the pandemic. And that's why, you know, as many have indicated, there are still significant problems. And as you may remember, when the 2015 Addis Ababa Action Agenda was signed, there were 3 focus areas, among others, of course, I'll just focus on the 3. Focus on strengthening domestic public resources, commitment by developed countries to increase overseas development assistance to 0.7% of gross national income, and 0.15 to 0.2% of ODA GNI to least developed countries. And then the third was reforming the global financial system to align with the Sustainable Development Goals and to put countries in the driver's seat. I think these were the three ones. In domestic financing, from 2015 to 2019, government spending on health increased in low and middle income countries, and it increased further in 2020 to control the pandemic. This was due to the panic, maybe difficult to say because of the agreement. However, per capita investment spending in low-income countries remains less than $10 US, with an additional 10 to 11 US from external aid. So this is, by any standard, very, very, very low, the $10 US. Therefore, there is still a significant need for increased public funding. In particular, countries which are already vulnerable now face greater fiscal distress and growing poverty and hunger. Health taxes on tobacco and sugary drinks, for example, are one way to expand the domestic revenue base while also addressing the drivers of non-communicable diseases. So the second is ODA. In ODA, as you know, some countries have made some progress, the 0.7%, but then those who have been leading even backtrack. So on the ODA, especially the GNI 0.7%, the progress is not as what we expected. Of course, the countries are justifying it due to many reasons, but we need to do more on that. And the third is the reforming financial system. I think many leaders have already said this, yesterday especially, and Prime Minister of Barbados, President of Kenya, including solutions, by the way, to the reforming the financial system. And the intervention of many of the leaders was focused on that, especially related to debt. And of course, there is this year's report on the Financing for Sustainable Development report, which highlights the progress, but also indicates the major challenges. So in general, there is progress, but there are still significant challenges, and that's why we have this meeting. The good thing from this meeting is many leaders were proposing concrete actions that can be implemented immediately. There is a political commitment or agreement. So I think it's time to really implement. We know the problems, we know the root cause of the problems. The gap is in implementing what we know.
And
Thank
why,
you.
very briefly, why particularly primary health care through these kinds of vehicles?
Yeah, why primary health care? Even the wealthiest countries were surprised during this pandemic. And the reason for their surprise was they couldn't manage COVID properly. Their investment on primary health care was low, while they were investing on high-tech, including robotic surgery and so on. So the investment was secondary, tertiary, very specialized services, while the primary health care was neglected. And this could be true, of course, less investment in primary health care for other countries. Actually, less, low-income countries invested better in primary health care because of the repeated attack by different types of infectious diseases. Could be cholera, could be Ebola, So relatively even better. So the citation which is meant for about primary health care, and that all banks are now really committed and agree is because it can help us, primary health care can help us provide services. Second, it can help us also to prepare for the next pandemic. It has both. If you take the services, more than 90% of services can be provided at primary health care. So and the investment you need at primary health care is low compared to the high-tech secondary and tertiary. I'm not saying we don't need the secondary, tertiary, and specialty services. We need, but we need to have a balance and invest in primary health care to provide services more than 90. For the pandemic preparedness, we have already seen it. It's a fresh experience. The strengths of the primary health care would help us either to prevent or early detect and then respond to epidemics.
Thank you.
Yeah, thank you.
Thank you so much, Dr. Tedros. Okay, but this is why we're here. And as you say, this is the beauty of the meeting today, to announce concrete action. We're delighted that we have actually the heads and the representatives of most of, actually, the multilateral development banks. We have the EIB, Islamic Development Bank, African Development Bank, Inter-American Development Bank, Asian Infrastructure Investment Bank, Council of Europe Development Bank, and the World Bank. So thank you so much, all of you, for joining. I'm going to do a quick fire round of questions now to you. I'm going to start with Dr. Hoyer, President of the EIB, and ask you to just reflect on the fact that this new platform has grown from a partnership with the WHO and the EIB. And I know that there are a number of you who already have partnerships with the WHO. How important, in your view, President Hoyer, is it to bring these people together, to have a platform, to work in a joined-up manner?
Thank you very much, Shireen. Excellencies, ladies and gentlemen, colleagues and friends. It's a great honor and pleasure to be here at this conference and this particular moment as well. There is a lot of talk about partnerships these days. The word is stressed very, very often. We must bring life to it. We must fill it with content. And this is an event now where we can say, okay, we walk the talk. It's this health impact investment platform, which we're launching today, is a landmark tool to strengthen primary health care in low and middle income countries and increase their resilience to future health threats. And I'm particularly grateful to my friend Tedros Adhanom Ghebreyesus, who has been championing this initiative for many, many years. The platform will facilitate access to crucial international financing for the most vulnerable. It shows that President Macron's call for increased financial solidarity worldwide did not go unheard. I'm proud that the European Investment Bank, together with our friends and colleagues in the European Commission, can be part of a concrete deliverable to this summit in the area of health. COVID-19 demonstrated the great human and economic suffering that can occur when we fail to invest in essential health services. It's a wake-up call to prepare for future health crises, and we know there will be some coming up soon. But even before COVID, many countries struggled to provide the financing needed to fulfill one of the central sustainable development goals, agreed by world leaders some 8 years ago, achieving universal health coverage by 2030. And this situation has only gotten worse. The pandemic, climate change, conflict, and resulting economic instability all increase the funding needs of poorer countries. So it is our duty to put the achievement of the SDGs back on track. As the EU Bank, we are doing our part to respond to the health investment needs worldwide. Last year, we invested more than 5 billion euros in health and life sciences. But the challenges are enormous. Individual countries cannot solve the healthcare conundrum on their own, nor can individual institutions. We need global solidarity and collective efforts. Cooperation between multilateral organizations and development bank proved fruitful right before and during the pandemic, when the WHO, EIB, European Commission worked together, for instance, with Angola, Ethiopia, and Rwanda, with the aim to mitigate the health crisis and to strengthen primary health care by mobilizing investments through technical assistance, grants, and loans with advantageous terms. If the minister is right, we need to be very more creative in this respect when it comes to tenors, when it comes to disaster relief clauses and similar things. The aim now is to prevent a new health crisis by strengthening primary health care and health systems resilience. With WH's expertise of health systems globally and the technical and financial know-how of development banks, we will be able to massively scale our impact without pushing countries into unsustainable debt. The initial value of investments to be facilitated by our new health platform, 1.5 billion euro, will obviously not be enough to bring universal health coverage for all, but it is a crucial step to achieving those common goals. You can count on us to bring this partnership to the next level, and I close by giving great thanks to all those in our institutions who have made this possible, because it has not been the bosses who have negotiated it, it has been our people in the institutions.
I fully agree.
And you know who you are. Thank you very much, President Koya. We're grateful for the support of the Islamic Development Bank. Unfortunately, the President himself is not here today, but thank you to his representative for attending, Karim Alawi. I'm going to pass now to President Adesina from the African Development Bank. President, I wonder if you can, to use Dr. Hoya's phrase, bringing it to life. How do you see the African Development Bank's work in bringing the partnership that you'll be signing as well later to life? How do you think this platform can make a difference?
Thank you very much. First, let me thank you, Dr. Tedros, and also thank you, my brother, Dr. Hoya, for organizing this event on accelerating investment in primary health and care and health resident systems. COVID-19 pandemic, obviously, as we've heard, taught us quite a big lesson. And that lesson is that the continent can no longer, as the chairperson said, outsource the health security of 1.4 billion people to the benevolence of others. While developed countries, Minister from Barbados was talking about that, while receiving booster shots, we just could not get even just a basic shot. And therefore, Africa must therefore build a healthcare defense system based on three priorities: the development of quality healthcare infrastructure, revamping Africa's pharmaceutical manufacturing capacity, and building Africa's vaccines manufacturing capacity. The African Development Bank launched its new strategy on quality healthcare infrastructure, which will see us invest up to $3 billion in support of African countries to develop quality healthcare infrastructure. Our investments will focus on primary healthcare infrastructure that we're talking about today, secondary and tertiary healthcare facilities, and diagnostic infrastructure. We will focus the largest share of our investments at the primary healthcare, as Tedros said, because of the challenges at that level are quite immense. Today, 30% of the population live more than 2 hours away from having essential health services. And 50% of the primary healthcare facilities in sub-Saharan Africa do not have basic water and sanitation, and only a third of them have access to electricity. The bank's investment will therefore prioritize the connection of all primary healthcare centers in Africa to reliable electricity, mainly renewable energy, and to water and sanitation as a principal intervention. We will also invest in the digitalization of primary healthcare centers to improve the transferability of patient data across primary healthcare systems. The bank will also scale up its investment in social protection and social health insurance schemes. The bank has therefore also launched a $3 billion financing program to revamp Africa's pharmaceutical industry. Our goal is to support what the Chairman Paki said, to move Africa to 45 to 55% of its essential molecules by 2030. Quality, safe, affordable healthcare requires also very good medicines. Finally, the African Development Bank has also established what's called the African Pharmaceutical Technology Foundation. This foundation will act as a transparent intermediator, advancing and brokering the interests of pharmaceutical industries globally and those in Africa to share IP-protected technologies, know-how, and patented processes. I'd like to thank Chairman Faki, thank you also Tedros, and several others that are going to be on the advisory council for this foundation, and to thank the government of Rwanda President Kagame, who is chairing the council, and several others that are there. As I close, let me say the African Development Bank is very delighted to partner with the World Health Organization, European Investment Bank, and other partners on this new health impact investment platform. Together, let's assure universal healthcare for all. The health of one, we've learned, is the health of all. Thank you very much.
Thank you so much, President Adesina. Let me turn to you, President Goldfein from the Inter-American Development Bank. I wonder if you could pinpoint some initiatives or projects that could be not just inspiring to us, but also replicable, perhaps under this new platform for partners listening today, and those who are listening online as well.
Sorry.
Don't worry.
Thank you very much, Shirin. It's a pleasure to be here. Thank you for my colleague, President Hoyer, Director General Pedro. Is health is clearly a priority of us. We came to office saying this is clearly something that we should be focusing our attention. We have been in partnership with the Pan American Health Organization under Jarbas Barbosa. We have been having quite a few meetings in Washington. And your question about replicability is essential. We have been asked here in the conference to be able to provide the scale, the financing we need in crucial areas. And to do it in a scale that we don't have it yet. And the way to do it is exactly what we're doing here today, looking at cases where we can bring partners, bring donors, bring concessional money, grants with us, replicate that, and reach the scale together so that we can actually reach our goals. And your question is, can we pinpoint? Well, let me just focus on one of them. We had experience at the IDB with the Mesoamerica Health Initiative, Central America. It's a 10-year partnership with foundations. In this case, Bill and Melinda Gates, Carlos Slim Foundation from Mexico, but also governments, Canada, Spain. They've provided grants, they provided also resources for technical assistance, and the incentives were aligned. It is a result-based financing model where the IDB will put the financing at the beginning, and when the country reached the goals, and that was primary healthcare, and it was concentrated on maternity and child. When they reached the goal, the grant was disbursed. And that meant that you actually could generate the result. So in countries like Mexico, Chiapas, which is the most vulnerable, indigenous women got a very large increase in care that they never had. In Belize, you have maternity complications just reduced dramatically. We had a similar model then replicated against malaria, and that actually gave some countries like Belize who eliminated malaria. So that way of bringing the donors and grant, having an incentive is essential, and I'm going to explain why. We need to be very smart and very particular of where do we include our concessional and grants. I think it will be in the additionality, in the incentive, in the place where you want to generate more results. And that is where I think this is the place to be. Thank you.
Thank you so much. And let me turn now to the Asian Infrastructure Investment Bank. I'm going to ask our following three speakers to be quite brief, so we hit the moment of the signature without everyone turning into pumpkins. President Likun, tell us how important you think the cooperation between the MDBs is.
Thank you very much. I will be very brief. Cooperation among all the MDBs is crucial for us to exercise our concerted efforts to deal with healthcare. And indeed, it does not take COVID-19 pandemic to tell us that healthcare is the weakest link on the chain. But
pandemic only amplified this weakness. The mandate of AIIB is the development mandate for all of the developing members. And I believe this is also the mandate of all the development banks. The essence of the broad-based mandate of our institution is deeply embedded in Articles of Agreement. We have the mandate, broad-based, to promote broad-based economic social development through investment in infrastructure and other productive sectors. So right after the outbreak of pandemic, we lost no time in launching a crisis recovery facility to support our clients in alleviating and mitigating the impacts, working with the World Bank, with ADB, and all the other members. Because we believe only a healthy nation is productive. So supporting healthcare system is to support a productive sector. That is why we've been working very hard, and in a very short period of time, we provided $13.5 billion of funding, including 20 public health projects, at a total of nearly $4.5 billion. Now, this cannot be achieved without working with all of the APBs. Thank you.
Absolutely, thank you so much. Governor Monticelli, thank you so much for joining us from the Council of Europe Development Bank. Now, your bank is very focused on the social part of investment. Can you describe how primary healthcare features in your portfolio? And coming back to this point as well, the importance of the MDBs working together.
Okay. The Council of Europe Development Bank is the Council of Europe Development Bank is the only multilateral development bank focused only on social. And it is the reason why healthcare is so important for us is simply because this good access to and equal access to healthcare is an essential human right, which is an essential component to make sure that society fits together in a way that nobody is left behind. We provide substantive support. In the last 10 years, we are talking about some 6 billion, and we try to cooperate very actively with the local level just to provide the type of support that is needed in a region like ours, where the primary healthcare needs are in non-communicable diseases. And this is where cooperation at the local level is absolutely crucial. Now, importance of collaboration. All the speakers have been very clear, and I can only just repeat what I say in terms of having common endeavors and cooperation to be absolutely essential to deliver. But I want to conclude to add one extra angle to this collaboration, which regards the liability side of our balance sheet. At the SEB, we pioneered the issuance of COVID bonds that are a good way to bring in financial markets to support healthcare. And certainly this is a further area of possible collaboration among MDBs.
Thank you so much, Governor. I want to turn to Axel van Trotsenberg. Thanks so much for joining us from the World Bank today. We've talked a lot about duplication, the importance of avoiding it, but also the focus on impact. It's something we're hearing a lot also from your new president. How important do you think that is in managing to deliver on this healthcare mission, which I know the World Bank shares? And once again, if I could ask you to be quite brief. Thank you so much.
Thank you very much. I think anything what we will do is it has to be focused on results and outcomes. And I think it is not only the health, all the areas. And I think there is an effort. But I think what the COVID crisis has dramatically shown is that we have to work together as a system and support ultimately the short-term and the longer-term intervention, particularly in strengthening health systems and particularly also primary health care. What I think is important is how can we do more? I think as a response to the COVID, and Tedros already mentioned this, is the better preparedness in the future. There, I think the G20 initiative of the pandemic fund creation was a good step forward. Lots more needs to be done, is because this is only seed money. So what will have to happen is, I think, there will need to be efforts on the domestic side as well as on the external side. On the domestic side, I think clearly more resources have to be made available, but on the external one, also, I think we have been actually scaling up. On average, we would do before the before the COVID, we would basically make commitments in the health area in the order of a little bit over 3 billion. We're now at close to 8 billion per year. So my expectation is that we will stay probably around that level in the future. So that is where we will focus not particularly on the low-income countries, but also on the middle-income countries. And I think we should not forget them as well. Thank you.
Thank you so much, Mr. Van Trotsenberg. Let me just ask, before I turn to you, Vanessa, who is the Special Envoy for Climate Change and Health for WHO, I just want to be sure that Dr. Alaoui from Islamic Development Bank does not want to make an intervention. Is that right?
That is correct.
Okay, fine. Didn't want to leave you out and cause a diplomatic incident there. Okay, but look, we're delighted to have you, Vanessa. Very briefly, how valuable do you think a platform like this can be for the health system resilience and primary care, the primary health care? Can it really bring, in concrete terms, because that's what it matters really, better health to people, to their lives, to their homes?
Without question. I mean, we can be very simple in that answer. But at the end of the day, we're talking about the health of people is human. And health is about the human existence and the human ability to care for your families, to go to work, to do all the things that we strive to do every day. And so this is a very human aspect of what we're doing, and it's very personal. The last years have shown us the absolutely critical role of health to our daily well-being. And it's also shown us that no country is immune. I'm an ICU doctor from the United States, and I saw us rationing care as well in our country, a country that always seemed that it had all the resources it needed. And so as we look at the burdens that we have faced traditionally, whether it is communicable disease, non-communicable disease, maternal mortality, malnutrition, that has now been really accelerated by a COVID pandemic, and now we're seeing that in climate change. Because the climate crisis is actually a health crisis as well, and our ability to address the climate crisis is going to be through a health-centered response. According to the WHO, 1 in 4 deaths today is already caused by a preventable environmental cause. And that is only going to accelerate an additional 250,000 deaths. That doesn't include the suffering and the cycle of poverty that is created from poor health that we're going to be facing from this. So in sub-Saharan Africa, for example, where Seed Global Health, the organization that I run, works, we've been seeing the impacts of climate change, as we heard described by the president here, on human health in very real time. Malawi, for example, has been seeing the longest and deadliest outbreak of cholera, which has finally just come out on the other side, which has been made worse by deadly storms caused by climate change. And that drives a vicious cycle of poverty and human suffering. And so as we talk about financing, we actually have to talk about creating savings, and we have to talk about preventing worsening debt and worsening suffering, and that means investing in health, because health is essential to economic growth, it is essential to our security, it is essential to strong communities. And the most expedient way to address this is going to be through the resiliency of health systems, investments in primary care, and investments in strong health systems founded on a strong health workforce and infrastructure that can deliver services. And we've seen this throughout COVID, but we're also going to see this in the daily fight that we see going forward through climate change. Finally, just to note that prioritizing health will prevent backsliding on decades of progress in economic development, health improvement, and poverty reduction. And paying for healthcare currently pushes almost 100 million people into extreme poverty each year. Preventing some of the underlying conditions could stop that cycle of disease and impoverishment, And that is through a primary care network that focuses on prevention and delivery of services upfront, not the back end where we are paying out already. But if we can put those in on the front end, we will leverage much more effectively. It is worth noting climate change is about to drive another 150 million into poverty immediately in the coming years. And so we're really caught in the cycle that we need to stop. Finally, just to add that realistic levels of adoption of many of these interventions could increase gross domestic products of lower income countries by 4.4 trillion by 2040. And that the economic return on investment for every dollar in health could actually do a return of at least $2 to $4. So what we're ultimately talking about is an investment. We're not talking about a cost. And we need to reframe how we think about the investments in health. So thank you very much.
Thank you so much, Vanessa, and welcome also to Prime Minister Motley, who's just come in at a great moment. Always a woman with great timing. Prime Minister, I'm going to give you a couple of words at the end, if I'm allowed by the organisers. But before I do, I'm going to pass to Commissioner Urpilainen, because we've been talking very much about this new platform. We've been talking about the support of the African Union and the European Union. At the centre of the European Union strategy, the Global Gateway strategy, is of course the goal of primary health care, the equity. Tell us how that features and how you think that the investment platform that we're announcing today can support that mission.
Thanks very much. I know that we are running out of time, so I will be very, very brief. So indeed, the European Union was in the front line in the response to the pandemic, and we also wanted to learn from it. And actually that is why we adopted in 2022 November a new global health strategy in order to help us deliver better also long-term health. And if I have to raise two issues which we learned from the pandemic and which are part of our new health strategy. The first one is the fact that Africa imports 99% of vaccines it uses nowadays and 95% of its medicines. And we know that this is not sustainable. And that's why through this Global Gateway investment strategy, we are working together with the EIB, with our member states and their DFIs in order to support vaccine production capacities in 4 African countries: Rwanda, Senegal, Ghana, and South Africa. So our aim is to strengthen the resilience of Africa so that Africa could produce its vaccines in Africa for Africa. And we have a similar kind of initiative also with Latin America, Caribbean region, as we heard. The second lesson learned was that actually in the middle of the pandemic, we faced a situation where despite the fact that there were vaccines, for instance in Africa, people were not able to get vaccinated because of lack of infrastructure, because of lack of skilled labor force. And that's why we have to invest in primary healthcare infrastructure and we have to invest in competent health professionals. And we do that through our bilateral program with our partner countries, but also through the regional program. And of course, the role of the WHO is very important here. We support also WHO's Universal Health Coverage Partnership. For instance, last November, Dr. Tedros and I, we signed a new contract of 125 million euros contribution, and we see the role of the WHO very important in this endeavor. So these very two simple issues are priorities of our global health strategy.
Thank you so much, Commissioner. In a moment, we'll be signing this new health platform. Our Minister has already very fluently and beautifully explained the relationship between what we're doing today and the wider Bridgetown Initiative. What I'd like to ask you, though, is a very concrete question. To what extent do you think that a platform like this, that actually brings some of the biggest MDBs together in supporting primary health care in a concrete investment platform, to what extent is this responding to the call at the heart of the Bridgetown Initiative, which you have been championing?
I think you throw me on a bit of the deep end.
I know, but I think he can swim.
Because Tedros begged me to come back. And I apologize for the late entrance of another meeting. Look, fundamentally, Bridgetown Initiative is about securing a safer world and planet. And that means dealing with global public goods. There is no more important goal than health. And there is no better way to deal with it other than through primary health care. Regrettably, we have gotten accustomed to ignoring a lot of the basic things in life. And what happened when the pandemic came was that we realized that we were half naked in facing this pandemic. So we need to go back to basics and to strengthen, but part of the difficulty, of course, is a very straitened set of fiscal circumstances. People don't have the elbow room. And in many instances, it's not because they don't want it, it's because they don't have it, because the debt sustainability metrics don't allow it, the other obligations that they have. We're talking about the climate crisis now, but the truth is, we've had to build coastal defenses for the last 40, 45 years before anybody thought it was cute to talk about it. So we need to create that elbow room for them. Secondly, Ruto was just now talking about the realization that you can't be exporting pharmaceuticals to the global south all the time. And I want to thank the European Union and the European Investment Bank, along with Rwanda, along with the IFC, for working with Barbados and Guyana to develop the pharmaceutical capacity. In fact, as we speak, the regulatory work is being done now on the Food and Drug Agency. There are cooperative arrangements between Rwanda and ourselves. And we need to be able to ensure that our citizens can access some of the best therapeutics that there are out there, in addition to vaccines. It has not been happening. And in a world where this is dominant, individual citizens know when they're not getting what is the best. And therefore you get an undermining of the integrity of the democracy, because people feel that you're just holding back on them, when in truth and in fact, there's just not the accessibility there. So I hope that we can, through the multilateral development banks, build capacity within the governments to be able to deal with primary health care in a more cohesive way, but at the same time to recognize that dealing with that without coming along the whole value chain is going to lead problems. And then thirdly, to find the right balance between the public and the private sectors in terms of the delivery of the different options that we have, particularly in the area of the pharmaceuticals. Dr. Tedros had spoken to you also about the fact that we really do need a global South Procurement Alliance on pharmaceuticals and basic medical equipment. Because in many instances, the other problem is that our orders are either too small, and therefore the unit cost of things are too high. And the example of the African Medical Supplies Platform was truly innovative in terms of its ability to deliver in real ways to the benefit of our people. That a country as small as St. Kitts and Nevis, with 38,000 people, could access product at the same price as in Nigeria with 250 million people made sense. And I want to thank WHO and the African Union for the leadership that it showed at that most critical time for ensuring that we had access when we most needed it. Thank you.
Thank you so much, Prime Minister. Let's get down to the business of signing the declaration, and then I'm assured that you will not be late for the closing session. We have the documents in front of you, gentlemen. The Islamic Development Bank will be signing separately, and I believe if you want to just sign by your name, you can go ahead and then pass the document on to your neighbour. Dana will instruct on at the back of the document. You will see your name. If you could sign there, and then we'll do a quick photo. Are we? The closing is not starting until 9:25. So please don't worry. Can we please sign? the signing. We can start assembling for the family photo. If those who are standing in front of the, for those of you standing in front of the backdrop, if you could just move to the side and we can do a quick photograph once you've signed. Let me get out of the way for you. You can join the photograph. Prime Minister, would you like to join the photo? And gentlemen. Both be in the Sorry. Okay. Minister, would you like to be in the photograph? Okay, so if we could just assemble behind the, in front of the backdrop. Minister will join you.
Thank you very much.
Dr. Tedros and President Hoyer. Somebody's out of the way. Take these out of the way, guys.
I should have
Okay, so. All right. Gentlemen and ladies, if we could assemble to some.
Excuse me. Can we have everybody move to the right a little bit, please? Thank you.
It's difficult for us, but let's
Step to the to have everyone. Thank you.
And wait a minute, just let the World Bank and Asian Infrastructure join. Okay?
Can we get everyone?
Okay, hold on a minute. Okay,
All right.
are we ready?
Everyone here?
Okay.
1,